Oversight Committee, CIRM's board. I'm going to call the meeting to order. Your leadership team is meeting here in person in the CIRM offices in South San Francisco. The rest of you are all joining us virtually, and I thank you for your presence. So the meeting is called to order. I'm going to ask Senior Executive Assistant Lana Morales here in the room to lead us in the Pledge of Allegiance.
Yeah, so we'll do that.
All right. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
T-shirts.
I'm going to ask Scott Tosher to call the roll.
I'm saying.
Ian Al-Nasri,
Present.
Kim Garrett,
Present.
Ann Bernal, George Blumenthal,
Here.
Leah Bonneville,
Present.
Joyce Sackey,
Present.
thank you, John Carruthers, Judy Chow, Mark Harvey. It's David.
I'm sorry, there's a lot of echo, at least that I can hear. So I am here and I just want to make you all aware of that.
Similar to the BCSC model.
If I could ask everyone to mute their mics until their name is called.
This is Leandra Clark Harvey. I am present. Thank you.
Thank you. Henry Juliage,
Present.
Isabel Daron,
Here.
Mark Fisher Colbury,
Here.
Elena Flowers,
Present.
Judy Gasson,
Here.
David Higgins. David, I think you may be still muted. One more time. I think he's still muted.
Here. Here.
Great. I think I heard it. Thank you, David.
Here.
Vito Bassiani,
Here.
Rich Lahara,
Present.
thank you, Rich. Pat Levitt, Paula Madna, Linda Malkus, Shlomo Melmet,
Here.
Carolyn Meltzer,
Present.
Chris Miaskowski,
Present.
Lauren Miller Rogan, Adriana Padilla,
Here.
Joe Panetta,
Here.
Marv Southern,
Here.
Suzanne Sandmeyer,
Present.
Carol Watson, Kevin Zhu,
Here.
Keith Yamamoto. Thank you very much. We have a quorum.
Well, thank you, Scott. For my chair's report, I want to, besides welcoming you to this final board meeting for 2024, which comes halfway through CIRM's 20th anniversary year, I want to go through and apprise you of 5 or 6 different items. Starting with this meeting itself. This meeting is virtual, and after a lot of consideration, your board leaders are going forward, alter the board meeting schedule slightly. Many board members, busy as they are in their professional lives, find it difficult to attend the December meeting in person due to the pressures of the holiday season caused by family and work celebrations and related travel. So it's difficult for us to justify the not insignificant expense and effort associated with an in-person meeting in December. Therefore, starting in the new year, we're going to bow to reality. We'll still have 5 meetings per year, with the regular scheduled meetings in January, March, June, and September occurring in person, and with the December meeting continuing as a virtual meeting.
So.
I have some appointments to announce. I'm delighted to tell you that the Intellectual Property and Industry Committee of the board, which has not had a chair since the departure of board members Mohammed Abu Salem and Steve Julesgaard earlier this year, will now have 2 co-chairs. So board members Hala Madanat, who is the Vice President for Research and Innovation at San Diego State University and the Johnson Distinguished Professor of Public Health, We'll co-chair that along with Kim Barrett from UC Davis. She is the Vice Dean for Research and the Distinguished Professor of Physiology and Membrane Biology at the University of California at Davis. It's the expectation that Kim's alternate member, Don Taylor, also of UC Davis, where he is the, the inaugural Chief Ventures Officer of UC Davis Health Ventures, will take on full responsibility for co-managing the work of the committee. And we're very fortunate that Hala and Don have had a working relationship that goes back many years. So thank you both for stepping up to this assignment. Next item concerns the annual report. It was released electronically to board members a week or two ago. And the hard copies, the print copies, are being printed as we speak. A Spanish language version is being prepared and will be sent to the printer when the translation has been checked for accuracy. The theme of this edition is CIRM's 20th anniversary, and it is replete with statistics, testimonials, and patient and researcher stories that try to capture the impact we have had on the field of regenerative medicine here in California and in the nation and the world. With respect to today's meeting, there are a number of significant items on today's agenda, including the research budget for the second half of the fiscal year 2024-25, the financial audit for the fiscal year ending June 30th, 2023. There's an item to augment funding for one of our educational programs, and a report and update from our president on the strategic allocation framework.
If you click the little carrot.
We will enter a formal closed session to discuss an item related to compensation of the vice chair. And finally, the board will hear a presentation on our social media strategy. I'm going to end this report by informing the board of a new priority for the chair, which I would like to launch in the new year. The project took shape as a result over the last 2 years of condensing the concerns of CIRM's long-term survival expressed to me by board members and others, and the ongoing work of the strategic allocation framework, a data-driven look at our portfolio, operational strengths, and remaining bond authority. I'm going to call this project, which will occupy the chair for the next 4 to 5 years, CIRM's Sustainability Project. And I hope to have a formal document ready in the new year. But what I'd like to share with you is a draft of a short executive summary. And I'm going to quote myself. CIRM was created by the voters of California in 2004 to fund research into the genetic basis for disease with the aim of developing cures for a myriad of diseases, both rare and prevalent. The money that CIRM uses to support regenerative medicine research and the infrastructure, manufacturing, and education programs that make this research feasible comes from its ability to derive revenue from the regular and successful sale of state bonds. This authority was granted a second time to CIRM by the passage of Proposition 14 in 2020. Estimates of how long the remaining funds, approximately $3.8 billion, will last, assuming a typical annual burn rate of $450 million, ranges from 6 up to 8 years, with sufficient funds reserved for 4 additional years so CIRM can see already funded projects through to their conclusion. This project will investigate all possible avenues to securing sufficient additional funding that will afford CIRM the opportunity to extend its useful existence past 2032 for an additional and as yet undefined period of years. The scope of this project will identify and align stakeholders, create viable courses of action, and secure the necessary resources for CIRM to achieve financial, operational, and scientific sustainability. This will allow CIRM to continue advancing regenerative medicine research, sponsor clinical trials, and bring cures to address unmet medical needs to the people of California and the world. The ICOC and its chair and the CIRM leadership team are committed to ensuring the agency's long-term success. This is synonymous with sustaining CIRM's viability for a set number of years beyond its present expected or projected expiration date. This can only be accomplished through the realization of a plan that allows CIRM to have access to a reliable funding stream. The successful completion of this project will require imagination and detailed planning, as well as sustained collaboration, innovation, and messaging by all involved partners. If successful, this proposed plan will align CIRM leadership and stakeholders with the strategic efforts necessary to ensure CIRM's continued impact on regenerative medicine through its foundational support of basic translational and clinical research in gene and cell therapies. So thank you for listening to this. I say by this recitation, I'm putting a place marker down to let you know my intentions of what will be my main priority for the foreseeable future. It involves an existential reality for CIRM, and I would not only welcome but expect input from any and all board members that have, let's call it a stake in this topic. So I welcome your input informally, and at some point, I guess we'll probably make it more formal through the creation of a working group or something like that. Okay. That is the extent of my report. Thank you. I'm going to see the,
Vito,
oh, yes.
can I just interrupt for a moment? Just the record will reflect that Dr. Carruthers has joined us as well after I took the role. Dr. Carruthers is Vice Chancellor for Health Services, an adjunct professor of public health at UC San Diego, and assumes Larry Goldstein's vacancy. So welcome, Dr. Carruthers.
Pleasure to be here. Thank you.
Thank you. We're going to be followed now by our President and Chief Executive Officer, Jonathan Thomas, who will give his president's report.
Thank you, Mr. Chair. Mr. Chair, Madam Vice Chair, distinguished board members and members of the public. While this is the President's report, I would like to dedicate my remarks to the members of our wonderful team. As the calendar year comes to a close, I can say with absolute certainty that this has been a year at CIRM unlike any other. When the year began, we were faced with a leadership change, a flood of applications across our three research pillars, a team that largely functioned as individual teams within the team, and the realization that we needed to seriously focus on how best to spend our remaining Proposition 14 funds going forward. At our first leadership team meeting in January, I challenged that group to figure out a strategy to deal with the increased applications, to collaborate amongst internal teams like never before, and to reprioritize our spending for the balance of the Prop 14 term, however long that may be. Out of that challenge came the flow control amendments to our review process in June, an immediate shift to increase collaboration between teams, the months-long data-driven strategic allocation framework, a fundamental amendment to our latest strategic plan, and an update on which I'll be giving later in the agenda, a major reorganization of the team to implement the strategic allocation framework. I should note we will be introducing new members of the team that have come on board since the adoption of that framework in September at our in-person meeting in January, so you can all meet everybody up close and personal, and the first steps towards developing concept plans to make the SAF happen. Accomplishing all of the above took complete buy-in from literally every member of CIRM, as each of them had input into one or more of those undertakings. Of significant note, all of this work was on top of everyone's day jobs, which were full-time to begin with. I can report to you here that the team embraced this challenge 150% and developed work product of the highest quality across the board. I have never worked with a better team or been more proud and privileged to be part of such an extraordinary effort. None of this would have been possible without concurrent buy-in from the board. Between board and subcommittee meetings, you met 20+ times to discuss the particular topics of the day dealing with these various undertakings. As always, you were all in and enabled all of us collectively, board and team, to carry out our job with flying colors. On behalf of the team, thank you for your unending support and guidance. In thinking about CIRM and the brilliant scientists we help enable, I am reminded of a quote by Ralph Waldo Emerson, which reads, "Do not go where the path may lead. Go instead where there is no path and leave a trail." That quote neatly captures the essence of what CIRM is all about. Helping scientists throughout the state at academic institutions, research institutions, and biotech companies to continually cut new ground in the search for therapies and cures that have eluded mankind to this point. As noted in our most recent annual report referenced by our chair, we have done just that for 20 years since the passage of Prop 71 in 2004 and are poised to continue for years to come. A few stats here are instructive. To date, we have approved over 1,400 grants for research on 85 different diseases ranging from the ultra-rare to the prevalent. Funded 9 alpha clinics, which have hosted 250+ trials for CIRM-funded and other research projects in which over 2,000 patients have participated. The grants we have given have led to over $25 billion in leveraged additional funds, an exceptional number by any estimation. On the workforce front, we have funded over 4,300 interns, trainees, and fellows. Dr. Kelly Shepard will be speaking on one of those programs, Bridges, later today. Our funding has helped lead to 50+ new businesses and over 56,000 FTE jobs in California. The list goes on and on. I will be reporting on these stats and much more at the meeting next week of the State Controller's Citizens Financial Accountability and Oversight Committee meeting in Sacramento, and will report back on that meeting at the board meeting in January. I would be remiss if I didn't note, since we last met, we have had a presidential election that will be leading to major changes in leadership at HHS, NIH, and the FDA. While we don't yet know how those changes will affect the regenerative medicine field, we are closely monitoring developments and will be poised to deal with whatever changes come down the pike. At a minimum, we believe that, as was the case in 2004 at CIRM's origins, California's importance in the field will only be magnified. We will, as we did then, rise to any challenges in our unrelenting march to fulfill our mission of bringing therapies and cures to patients with unmet medical needs. Lastly, a personal note of thanks. At the beginning of the year, you asked me to serve as interim president and CEO while you conducted a national search for a full-time replacement for that position. I happily and enthusiastically acted in that capacity through the first half of the year and was honored at that point to be picked for the full-time job. Thank you for giving me that opportunity. It has been a most interesting and fulfilling year working with all of you. I look forward to even bigger and better things as the new year begins and our efforts continue apace. Mr. Chairman, back to you.
Thank you, Jonathan, for your report. Moving on to the consent calendar, there are two items. With item 5 includes minutes from the past two meetings of the September 26th meeting of the board and the November 21st meeting of the application review subcommittee. And item number 6, I mentioned in my report the appointment of co-chairs to the intellectual property and industry subcommittee. This is the agenda item that makes that happen. Anyone desire to abstract any item from the consent calendar for discussion? If not, I'm going to ask Scott to proceed to a roll to accept.
Need a motion.
Thank you.
Move approval of the consent calendar.
Second.
Movement and Maria seconded. Any comment on the consent agenda before we proceed to a vote? Or from the public? Anything online? Nothing.
hands raised.
Okay. Okay, Scott, you're free to go.
Yet Al Nasri,
Yes, approve.
Kim Barrett,
Aye.
George Blumenthal,
Yes.
Maria Bonneville,
Yes.
John Carruthers,
Aye.
Leandra Clark Harvey,
Aye.
Deborah Dees,
Yes.
Anne Marie DeLiege,
Yes.
Isabel Duran,
Yes.
Mark Fisher Colbury,
Yes.
Elena Flowers,
Yes.
Judy Gasson,
Yes.
David Higgins. Sorry, David, I can't hear you. I'll come back.
Yes, yes,
Great, thank you, David. Vito
Sorry.
Bacchiani,
Yes.
Rich Lahara,
yes.
Linda Malkus,
Yes.
Shlomo Melnick,
Yes.
Carolyn Meltzer,
Yes.
Chris Miaskowski,
Yes.
Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Joyce Saki,
Yes.
Marv Southard,
Yes.
Suzanne Sandmeyer,
Yes.
Kevin Zhu.
Yes.
Thank you very much. Motion carries.
Thank you. We're going to move to agenda item number 7. We're going to consider a supplement to our Education 2 program known as Bridges, and the presentation will be led by Kelly Shepard. Kelly?
Thank you. Can everybody see my slides and hear me?
Yes.
Great. Thank you. Good morning, members of the board, members of the CIRM team, and members of the public. It is my pleasure to come before you today to present for your consideration a supplemental funding to extend by 12 months our Edu2 Bridges training grant programs. I'm going to go through the rationale for why we are bringing this request to you today. And there are also more details elaborated in a memo that has been attached to this item in the agenda. So let me just first begin by giving a little bit of background and putting the Bridges program in the context of our education and workforce development programs that are currently active at CIRM. As you can see, we have 4 active programs that train students along the educational spectrum ranging from high school to postdoctoral and clinical fellows. The item that we will be discussing today is specifically focused on the Bridges program, which you see right here in the middle. This is a program that has been continuously funded for the last 15 years through a series of RFAs, beginning back in 2009 with TB1, and then through competitive renewals and updated RFAs through EDUC2, and then most recently in 2021, shortly after the passage of Proposition 14. So to briefly remind everyone what sets the Bridges program apart from our other EDUC programs, this program whose objective is to prepare diverse undergraduate and master's level graduate students for highly productive careers in stem cell and gene therapy research and therapy development. The way this program is structured is that it was integrated within bachelor's, master's, or certificate granting programs at institutions that did not receive CIRM-funded infrastructure awards under Proposition 71. So these programs, because they were built on these bachelor's and master's programs at these institutions, the students are matriculated there and they take their courses and special courses that were developed as part of their Bridges program at their home institution. But then a key element of Bridges is that once those courses are completed, the students go and do a full-time hands-on paid internship, in most cases for up to 1 year at a host institution, which is a major research organization or biotechnology company that has regenerative medicine programs and faculty available to help train these students. Students also complete patient engagement and community outreach activities as part of their program and participate in an annual conference at the end of their training. So these are the 15 active Bridges programs that we have across the state. Each one of these is a separate grant. You can see that they are based at the California state universities and community colleges. As I had mentioned previously, these are institutions that don't have major federal funded research infrastructure in regenerative medicine and faculty. So sorry. So earlier, our president and chair also referred to the strategic allocation framework process, where a series of goals were recommended last September by our board, yourselves. And I just wanted to remind you of the goal that impacts the programs that we're speaking to currently, which is goal 6. So the 6th goal was to bolster CIRM's workforce development programs to address gaps and meet evolving demands in regenerative medicine. And one particular recommendation that came through with this goal was to provide high demand technical training via Bridges and Compass program updates, which would include increasing the types of training offerings, diversifying the types of internships, increasing integration with CIRM's research and development grants, and other operational improvements. These changes are significant enough that it merits a concept amendment in order for Bridges to continue, which means we would issue a new RFA and the existing programs would have to compete. They'd have to actually update and revise their programs and compete for a new tranche of funding under the new RFA. In addition, with a new RFA, there could be additional Bridges programs other than these 15 that I've mentioned that could be developed and compete for funding as well. But due to the timing of these circumstances, we have a challenge in front of us. So the 15 education grants, most of them are in their penultimate year of support, meaning they are in year 4 of 5. And because these programs are structured in 2-year increments where students are taking their courses at their home institution in year 1 and doing their internships in year 2, they actually, in order to maintain continuity, would need new funding by quarter 3 of 2025 to avoid a loss of cohort or loss of continuity with their existing programs. So in order to make that happen, we would have to have an RFA almost right away with application due dates in April of 2025 or so, a review in the summer, and funding decisions in the fall of 2025. Now, the above timeline really presents a challenge for current EDUC grantees to appropriately modify their programs. This would only give them a month or two to really make some major changes that we're envisioning for a concept that has yet to be brought to you for consideration. And moreover, this timeline would really strongly disadvantage any new California state universities and colleges that don't already have a Bridges program that they can build from and adapt, who would need time to develop a program and become competitive for their own new Bridges award. So what I'm presenting for you today, your consideration today, is a proposed mitigation for this situation. And this is not really an entirely new situation. This has happened when we've updated Bridges programs over the years and undergone major transitions, particularly most recently between Proposition 71 and Proposition 14 funding. So what we are proposing is that we would follow established precedent from our previous renewals of the Bridges programs And we request an allocation of $10.03 million to extend all 15 of the Active Education 2 programs or Bridges programs by 12 months to avoid a loss of continuity and to provide sufficient lead time for the existing programs to be modified to compete for a new round of funding, and also to allow significant lead time for competitive new programs to be developed by other Cal State universities and community colleges. So as in previous situations, an extension supplement would be conditioned on a demonstration of good standing and progress by the grantees, by the current grantees, and an adequately justified supplement request. So this is what the timeline of the actions that we would be bringing to you based on this action that we're asking today, and then what the next steps would be. So today we are requesting a supplement which would provide a year 6 to these programs, which are only funded for 5 years. This would allow us time to bring a revised Edu2 or Bridges concept to you for consideration in early next year, either at the March or the June 2025 meeting, as part of the new concepts that we're bringing forward from the strategic allocation framework. With your approval of that new concept in that timeframe, that would allow us to post the RFA by the middle of 2025. And that would give the entire rest of the year and the beginning of 2026 for awareness to be raised and for us to consult and for new programs that might want to put together a new bridge proposal to put that together. We could host informational webinars, et cetera. So this would be a long enough lead time that we think it would be much more fair both to the existing programs as well as any new programs that might try to compete to create their own Bridges program at a new institution. So with this timeline, new Edu2 or Bridges applications with the strategic allocation framework modifications would be due around Q1 or 2 of 2026. The grants working group review would happen in the middle of 2026, and then funding could begin in August 2026 in time for these programs that successfully compete for refunding to maintain their continuity from their existing infrastructure with their new program. So in conclusion, we are requesting an allocation of $10.03 million to support up to 15 supplements to extend each of the 15 Bridges programs by up to 12 months. The maximum amount for each supplement would be the same as the 1-year budget period for the current award. The supplement will be conditioned on good standing, a demonstration of good standing and performance to us, and the CIRM team will follow an internal process for reviewing and implementing supplements following historic precedents. And that concludes my presentation and request. I'm happy to take any questions if there are any.
So, board members, we're welcome you, right? So board members, we have a request for an allocation, a supplemental allocation of $10.03 million to support the extension of the Bridges program. I would like to entertain a motion to accept the recommendation to allow discussion.
I move. Or
That was Anne Marie, I think, that moved?
yes, I'm either way. Yeah.
Thank you. And do we have a second?
Southern seconds.
Southern second. Thank you. Discussion on this request is now open to board members.
Vito?
Yes, Isabel.
Isabel,
Thank you. First of all, Kelly, I want to say,
Isabel,
Wait,
yes,
Isabel, hold
You're
on one
conflict.
second, please.
okay.
you're in conflict with this item, so I'm afraid you can't comment. No problem. That's why we're here.
Okay. Any other board member not in conflict want to speak on this item? Anne Marie.
Yes, maybe as I can sense what Isabel would say, and I'm not in conflict. I hope I'm not going to betray your thought. But first, Kelly, great presentation to all. The perfect idea. It makes complete sense. Maybe the question is, how is the DEI, the diversity, going to be reinforced at this opportunity to continue to improve that program?
Thank you. And I'm really glad you asked that question because the time you might recall that when Proposition 14 passed, we were at a stage where some of our Bridges programs were actually running out of funding. And we knew it was going to take some time to put together a new RFA under the new proposition. And so we did it very quickly. So we actually issued that RFA in March of 2021, just a couple of months after we found out it passed, and we had to do it quickly. So at that time, we did have DEI. The Bridges program has always had a strong DEI focus in terms of trying to do everything they can to recruit the most diverse and underserved student groups into these programs. But the our thinking and what was asked for in the application at that time was not as mature and developed as it is now, because there have been a couple of years to refine how we implement and execute on DEI plans and other programs. So although it's already an element of these programs and they pay strong attention to it, and we expect things from them in their progress reports, we see these supplement requests as an opportunity to kind of realign them and update their DEI plans and ask them to update them for this final year, not only to bring them into alignment more along the lines of our thinking today, but also to prepare them for what we're going to be asking in a new RFA when that comes, which is going to be in even above and beyond what we're already doing for diversity, equity, and inclusion. So I'm seeing this extension as an opportunity to help update even before a new concept comes for the remaining years in these existing 5-year grants.
Thank you. Excellent. Thank you.
Thanks, Kelly. Additional comment from board members? There is none. Okay. Any member of the public want to comment on this motion? There are no comments. Scott, then we may proceed to a vote on the consideration of the supplement.
Anne-Marie Deliege,
Yes.
David Higgins,
Yes, but
Vito Mazziani,
Yes.
Rich Lahara,
yes.
Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Marv Southard,
Yes.
Kevin Zhu.
Yes.
Thank you, Kevin, and motion carries.
Thank you, everyone.
Great. Thank you, Kelly, for your presentation. Moving on to agenda item number 8. This is the consideration of the actual research budget for the second half of the fiscal year that we're all in. And this presentation will be led by our Jennifer Lewis. Where are you, Jennifer? Let's see.
I'm right here.
There you are.
Happy to.
Okay.
Thank you. Let me share my screen one moment. Good morning, members of the board and public. Thank you for the opportunity to present today. Can you see my screen?
Yes.
Yes. Great. Thank you. My name is Jennifer Lewis. I'm the Vice President of Operations at CIRM, and today I'll be taking you through the fiscal year 24-25 research budget update. Just a reminder for everyone, in June of 2024, the CIRM team came to the board to approve a 6-month research budget, which is unusual, but given the changes in strategic allocation framework, we came with a 6-month budget, and knowing that we'd come back in December to ask for funds for the remainder of the year. So today I'll go over that. And as always at CIRM, we start with our mission: accelerating world-class science to deliver transformative regenerative medicine treatments in an equitable manner to a diverse California and world. So the agenda today, I'll go over the grants funds budget overview. So how much funding does CIRM have for research across propositions? I will go through the actuals for fiscal year 24-25 from July through December, and then the proposed January through June fiscal year 24-25 research budget and the considerations that went into developing this. So this slide I wanted to share with you is as of October 31st, 2024. As for the board members, $7.72 billion is allocated for grant funds. This is across Prop 14 and Prop 71. And as we've discussed throughout this year, as we've been refining our strategy, we have encumbered about 3.95 billion to date, and unencumbered balances 3.77 billion to date. So we're about still at that 50% mark. This next slide hones in on Prop 14 and the research budget allocation that is specified in this bond measure. So Prop 14 is specific on certain earmarks that are allocated to different pots of money, which I can walk through with you. So as of the end of October, this first bar demonstrates 3.4 million that is for 3.4 billion that's for research, therapy development, and therapy delivery. So this is our general research budget. And as you can see, the blue bar represents how much has been committed to date, and the red bar uncommitted. The next bar demonstrates the earmark for diseases of the brain and central nervous system, which is that neuro allocation, which is 1.38 billion. And the last bar is demonstrating the access and affordability allocation of 96 million. As you can see, we've allocated 2 million to date, with 94 million remaining. To the left, this arrow on the side, there are two call-outs and earmarks for up to amounts. So there's a cap of 26 million to build and equip shared resources labs, which the board may recall these awards have gone through the approval process and come to the board and the ARS for approval. We are in the midst of contracting these awards. So in my next presentation at the end of the fiscal year, I'll have actuals to show of how much has been committed against that balance. The second earmark is build, equip, and operate community care centers of excellence, which has an up to amount of 78 million to cover that portion of those awards. As you'll recall, during the fiscal year, a concept was developed and presented to the board for the Community Care Centers of Excellence. The CIRM team has taken in applications, and those recommendations will come to the ARS later in the fiscal year. So this next slide is as of the end of June 2024, and what this is showing you is the historical research budget performance since Prop 14 was initiated. Each bar represents a specific year of allocation in the proposition, and the blue bar is demonstrating the amount committed by the board during that fiscal year, and the red bar is demonstrating the amount uncommitted. I also want to note just underneath each bar is showing the total amount that's been approved by the board each fiscal year, which I can walk through. For year one, January through June 2021, that was a $352 million budget. For fiscal year 21-22, there was a $474 million budget. 22-23, $426 million budget. 23-24, $519 million budget. And the budget that was presented for the first 6 months of this year was $410.5 million for 24-25. So now I'll review the actuals for the July through December period of 24-25. This first column shows the approved budget of $410.5 million that the board approved for the 6 months of activities. $145.5 million was allocated to CLIN, $60 million to our translational program, $116.2 million for discovery, no funds allocated for education, and $88.8 million allocated for infrastructure. The commitments to date and where we also are estimating to finish, and I apologize for the extra column here on pending commitments. Our activities have been robust in scheduling, so at this time we have no pending commitments coming today, but $160.6 million has been committed by this board through December. $43.7 million through for the clinical program, $0 for translational program, $89.9 million for the discovery program, and $26.8 million for our infrastructure program, which is ending this 6-month period for $160.6 million. I'm going to take you all the way to the last column, the 5th column, the variance, which I'll go through step by step the rationale for the variance in each of these buckets. So for clinical, we have a variance for the 6-month period of 101.7 million. This is due to a couple factors. One is, as you recall, the qualification process reopened during this period, and that process has been we've been going through and accepting applications. One of the reviews and approvals that we anticipated bringing this board by December was review was delayed due to scheduling for a week or so, and so those approvals will actually not come to the board till January. In addition, there were several other I'll note that we've had also seen during this period some applications come in that are the total award amount is less than maybe we've anticipated in previous budgeting cycles. So it's something that we're monitoring as we think about budgeting going forward. For translation, there is a variance of 60 million. The CIRM team conducted a translation review and has had applications that have been scored by the GWG. Due to scheduling and conflicts, this ARS meeting where the translation awards will be approved will now be in January. So you'll see that reflected in the next 6-month budget. For discovery, 26.2 million is the variance remaining for the year. This variance is mostly due to the Remind L program. As you recall, the board approved the Tier 1 applications for the newly launched Remind L program during these 6 months. Several applications received a Tier 2 score, and the board supported the CIRM team's recommendation to allow those applications to come back in and go through the process again. So that you will also see a portion of this 26 million requested again through January through June, as the CIRM team has opened that process and is conducting those activities. And then finally, the infrastructure program, there is a variance of 61.9 million. 60 million of that variance is due to the Community Care Centers of Excellence. As I mentioned, we have conducted the review and are going through our normal review process. The ARS meeting for those applications will not be conducted until the January time period. So again, you'll see a request from the team for those funds in the January through June time period. So the total variance is 249.9 million. But to note that many of these variances are due to operational delays that will be conducted during the next 6 months. So now I'll proceed with the January through June proposed research budget. So again, the rationale for coming back to you for a 6-month budget was as we were developing the strategic allocation framework recommendations, we wanted to make sure that we were looking at the next 6 months under that umbrella. JT will be presenting to you later today an update on that, and to note that the January through June timeframe of this budget that I'm presenting today does not include any approvals for awards that would have these new concepts. These concepts will be coming to the board through this period, but those actual approvals will not be seen by the application review subcommittee until the 25-26 budget period. So what activities does this budget support? I'll walk through with you. Those will be the CLIN approvals for any Tier 2 awards that come through, that have been coming through our cycles over the past 6 months with qualification. They would also include the translation round that I mentioned and community care centers application approvals. So those applications have come in, have been, there's meritorious applications recommended by the GWG, and we'll have 2 ARS meetings during that period. It also includes just 4 Remind L approval of Tier 2 awards. In addition, it includes a final round of the Discovery 0 review and application, review and approval. To a reminder to the board, those are our foundation awards. And so we have opened that process and we'll conduct that review and bring forth any meritorious applications during this period. In addition, it includes 2 conference requests for our education pillar. That's to support our SPARK program, our high school program annual conference, and the second edition of our Pan Edu Training Conference. So these would be 2 RFAs that'll go out to support both of those conferences. And lastly, it also supports, as Dr. Shepard just presented, the concept to extend the Bridges Awards for 1 year. So here's a breakdown by pillar of what goes into the totals of this request. For Discovery, the total request is 57.8 million. This includes the funds of 37.1 million for the Foundation Awards, as I mentioned, which is an estimate of 12 awards. It also includes the Tier 2 approvals for Remind L, which is estimated to be 20.7 million. About 2 to 3 awards could be approved under that budget. For a translation budget, the total is 60 million. This estimated will yield 13 approved awards. And for CLIN, the total request is 76.7 million, which includes one pending January ARS approval. In addition, it supports 11 applications that have gone through our cycle and are looking at the total award, the highest total award amounts for these applications, and using our success rate of about 57% going through our process, we estimate there'll be about 6 approved CLIN 1 or CLIN 2 awards during this period. For the education budget, as mentioned, the total is 10.5 million, which includes 2 conference awards, as well as the $10 million for 15 extensions for the Bridges program. And lastly, it includes 60.2 million for 9 awards for the community care centers. So this last slide shows the estimated to finish for the July through December for the of 160.6 million. The second column shows the proposed budget of January through June of 265.2 million. This would leave a total budget for the fiscal year of 425.8 million. So the request for today is for the board to consider and approve the research budget for the next 6 months of 265.2 million. And I'm happy to take any questions, and I'll hand it back over to you, Vito.
Yeah. Thank you, Jen. That was a very lucid, straightforward presentation. I appreciate that. So let's require a motion to enable the consideration of this request.
So moved.
Second.
Marv Southard.
I heard
And
George.
George Blumenthal seconded. Thank you. So comments on the presentation and the request from board members?
Anne
Marie, you're first.
Yeah, Jennifer, as it's always the case with the presentations done by the CIRM team, it's just a very clear presentation. It makes a lot of sense. Very minor question is the fact that we were significantly underspent, mostly due to the delay in approving some of the grants that you had explained to us actually in between the last meeting, and will be recovering on that at the beginning of 2025? Or is it that there was an insufficient number of valuable applications?
It's the former. Many of that variance that I showed you will be coming. My understanding is to a January ARS, and so many of it has to do with various scheduling, as you alluded to, or quorum, or things of that nature. So not necessarily plenty of meritorious applications. So definitely have applications to fill those budgets.
Thank you very much.
Any other board member have any questions of either Jen or general comments? You don't see any. Okay, great. Does any member of the general public want to comment on this request?
There are no hands raised.
There are no hands raised. Okay, thank you, Claudette. So, Scott, we can proceed.
The motion is to approve the budget request for the second half of the current fiscal year. Iyad Al-Masri.
Aye.
Kim Barrett.
Aye.
George Blumenthal.
Yes.
Maria Bonneville.
Yes.
John Carruthers.
Aye.
Leandra Clark Harvey.
Aye.
Deborah Dees. may have stepped away. Anne Marie Deliege,
Aye.
Isabel Durand,
Yes.
Mark Fisher Colbury,
Yeah.
Elena Flowers,
Yes.
Judy Gasson,
Yes.
David Higgins,
Yes.
Rich Lahara,
Yes.
Linda Malkus,
Yes.
Shlomo Melmed,
Yes.
Carolyn Meltzer,
Aye.
Chris Miaskowski,
Yes.
Adriana Padilla, Joe Panetta,
Yes.
Joyce Saki,
Yes.
Marv Southard, sorry, Marv, I didn't hear you.
Yes.
Great, thanks. Suzanne Sandmeyer, I got it.
Yes.
Vito Bassiani,
Yes.
Kevin Zhu.
Yes.
Great. Let me come back to David Higgins.
Yes. Yes.
Thanks, David. Okay.
Well, good. Well, great. Thank you. We are funded through June 30th. Thank you. Okay, now I'd like to pass the gavel to one of the co-chairs of the governance subcommittee, Judy Gasson, to consider a recommendation regarding compensation.
Thank you very much, Mr. Chair. And the first part of this discussion will take place in closed session. So if I can ask Scott to read the
statute.
the statute.
Yes.
I was going to try to do the number, but it's too complicated.
It is. Okay, so the board will be adjourning to closed session for a discussion of personnel. Pursuant to Health and Safety Code Section 125290.30, subdivision small f3 capital D. For those of you on the telephone, you will receive or see a link or a pop-up that will say join the breakout room. Click on join, please.
Okay, welcome back, everyone. Pardon me. We are now back in open session, and I'm going to ask the co-chair of the governance subcommittee for a motion because no action was taken during our closed session.
Thank you, Chair. I would like to move that we approve a 3% merit increase for Vice Chair Maria Bonneville, retroactive to July 1st, 2024.
Seconded.
That was Steve.
Okay, we have a motion and a second. Any discussion on this motion? The board members, okay. Any discussion from a member of the public? And we do not see any hands. Okay. So Scott, we can go to the roll.
Iyad Al-Masri,
Aye.
Kim Barrett,
Aye.
George Blumenthal,
Yes.
John Carruthers,
Aye.
Leandra Clark Harvey.
Aye.
Thank you. Deborah Dees,
Yes.
Anne Marie Juliege. I'm sorry.
Sorry,
Anne
yes,
Marie-
yes.
Oh, thank you. Isabel Durone,
Yes.
Mark Fisher Colbury,
Yes.
Elena Flowers,
Yes.
Judy Gasson,
Yes.
David Higgins,
Yes.
Vito Imbasciani,
Yes.
Rich Lahara,
Yes.
Hala Madnat.
Yes.
Thank you. Linda Malkus,
Yes.
Shlomo Melmed,
Yes.
Carolyn Meltzer,
Yes.
Chris Miaskowski,
Yes.
Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Joyce Sackey,
Yes.
Marv Southern. Sorry, Marv, I didn't hear you both. I'll come back to you, Marv. Suzanne Sandmeyer,
Yes.
Kevin Zhu,
Yes.
and last call for Marv.
He's moving.
Oh.
It's,
Sorry, Marv, I think I see, I think you see
Link once for you.
saying aye. Great, thanks very much. The motion carries.
Motion carries, good. Great, it's good. Thank you, everyone. So we are now going to hear from our president, an update on the implementation of the strategic allocation framework. Jonathan Thomas.
Thank you, Mr. Chair, and members of the board and public. I'm pleased to present an update on our SAF implementation. I just wanted to note at the outset, in addition to the entire team spending many hours on this, special shout out to Chief Science Officer Dr. Rosa Caneta-Vilas for her leadership in developing this plan throughout the many months of 2024. Next slide, please. So what we're going to do here is go over a recap without going into exhaustive detail on the goals and recommendations that the board passed in September. And then we will proceed to where we are in implementing plan that was approved. That will involve, among other things, a review of the concept plan development timeline, and then we'll have time for any questions that you may have. Next slide, please. So you recall that the reason for the SAF to begin with was we had this combination of things in the beginning of the year, including the exceptional demand across all our pillars and the realization that we needed to strategically, for the first time, really in CIRM's history, evaluate what our priorities are for spending going forward as we deploy the balance of the Prop 14 funds that are still available. And that led to the launch of the development of the strategic allocation framework, which, as you can see, is a structured and data-driven approach to prioritize resource allocation and provide recommendations to the ICOC for continued implementation of CIRM strategic plans. That effort led to a series of goals and recommendations which were developed by the board either in subcommittee, working group, or full board over the course of 2024 that led to the adoption of goals and recommendations in September itself. Next slide, please. So you'll remember that there were 6 goals. The first, catalyzing the identification and validation of at least 4 novel targets and biomarkers, ensuring integration into preclinical or clinical research for diseases in California. That led to a couple of recommendations. Number 1, support comprehensive discovery research through DISC-4 and DISC-5 funding structures. Number 2, establish a data coordinating and management center, or DCMC, to streamline data management and enhance the utility of cross-disease data. I won't go into detail, as we've done this already, of the elaboration on the recommendations, but they are on the screen here for your review as we go over these goals and recommendations. Second goal we had was to accelerate development and utilization of 5 to 8 technologies that have the potential to improve safety, efficacy, and/or quality of cell and gene therapies. Principal recommendation arising from that was a pilot infrastructure technology platform program to bridge the gap between research and commercialization. Next slide, please. Third goal was to advance 4 to 7 rare disease projects to BLA. Recommendations there included: number 1, accelerate current rare disease therapy pipeline. Number 2, pilot platform-based therapy development program, which is to be led by Dr. Ablakrisi on our team. Number 4, goal to propel 15 to 20 therapies targeting diseases affecting Californians to late-stage trials. Recommendations included: number 1, to streamline preclinical development programs and to update our CLIN2. I will say that the streamlining of the pre-clin is a particularly challenging undertaking as it involved the amalgamation of 4 existing programs that all touched on preclinical aspects, those being DISC-2, TRAN 1 through 4, and CLIN1. That's led to an entirely different team, which we call PDEV, which I'll mention again later on here. And then the updating the CLIN2, obviously very important as we embark on bringing the scope of CLIN2 into the contemplated plan for the SAF as it gets developed over time. Next slide, please. 5th goal was to ensure that every BLA-ready program has a strategy for access and affordability. This is all, of course, under the auspices of our august vice chair, who leads the AAWG in implementing the programs that we're going to be developing. Recommendations here included: number 1, strengthening clinical infrastructure connectivity. Number 2, support development of market access and reimbursement strategies. Number 3, influence policy. And number 4, to enhance partnerships. Each of these are major undertakings. All of this, of course, was further to the advent of the AAWG, which was a new feature in CIRM's armamentarium, if you will, which talks to the notion that the field is advancing. We're going to be having therapies and cures that need to be accessible to all Californians, and has a number of challenges on the affordability front to which CIRM can lend its hand. Next slide, please. Finally, as referred to by Dr. Shepard in her bridges, motion, agenda item, number 6, to bolster CIRM's workforce development programs to address gaps and meet evolving demands in regenerative medicine. These included recommendations, number 1, to provide high demand technical training via Bridges and Compass program updates. Number 2, create new EDUC program to develop hybrid skill sets. Number 3, launch outreach campaigns to educate the public and increase diversity of California's regenerative medicine workforce. Finally, there were a couple of additional recommendations that fell outside the purview of the 6 goals. These are, number 1, to restart the grantee conference to report SAF goal progress. We're already having some preliminary discussions on that topic. And number 2, to keep conference grants for specific CIRM needs. For example, EDU 1, Mechanism 2. Okay, next slide, please. That sort of brings us up to where we got in September. So now we're going to proceed to where are we going forward. Next slide, please. Okay, keep going. Thank you. Okay, so out of the SAF came a number of concept plans to be developed. Some were amendments to existing concept plans that required considerable change, but not enough to merit being a new plan in its entirety. Others were new, as these are programs that are above and beyond what we have now and require individual concept plan and amendments, new plans going forward. The idea here was we have all these different concept plans. We wanted to prioritize the order of which these came to the board. They are each a very considerable amount of work, and as you will see when they come to the board, and in the process of prioritizing the sequence, we wanted to bring the first 3, 1 each from our existing 3 basic pillars: discovery, translation, and CLIN. Those being, for discovery, the revised DIS4, DIS5 for discovery research. Pre-CLIN is the new program I just described, where we put together the 6 existing preclinical programs, and finally the CLIN 2 updates. These being the first 3, we're targeting bringing to the board in March. I can report to you that the teams are busily at work putting these together. There will be a number of steps that will take place with board involvement prior to coming to the board, much as was the case throughout the development of the SAF over 2024. We'll get to that in a minute when we look at the timeline. The others that are not shaded in blue are going to be coming variously, the concept plans at different times going forward over the course of 2025. Next slide, please. So this slide, this is the concept development of the first 3 programs that I mentioned on the previous slide. This is a timeline for what's going on each of those. So we're in the middle of the first, October to December, which is to define the initial program frameworks to align across programs. In early January, we will have developed program announcements and draft concepts. Those will go in late January to committee chairs with revised concept or program announcements resulting based on the feedback of that series of calls. In February, we will re-review those concepts with the chairs, revise further based on that feedback, all leading to the science subcommittee in early March, at which point these 3 concept plans will be presented, looking for recommendation to move forward to the full ICOC, which at its board meeting in person in late March will be presented for approval. Next slide, please. Once the concept plans are adopted, of course, that leads to program announcements and the application process. The development of the program announcements will be proceeding concurrently with the sequence I just mentioned on the previous slide, so that once, hopefully, the board approves the adoption of the 3 concept plans in March, we'll be well into the development of program announcements implementing the concept plan. So you can see here the timeline for that process. Late January, the initial application framework will be defined. Late February, we'll submit GMS requirements to IT for system updates. I welcome all of you, by the way, to at some point engage with Jen and IT for a primer on everything that goes on at the GMS from an IT standpoint to bring each of these sorts of concept plans and programs online. It's quite an education. Says your device is okay. So the device was disconnected. Okay. Quite an undertaking. I think you'd find it really very interesting. In late March, we'll complete the application templates and finalize the review module specs. Again, that's involving the GMS. In April, we finalize and post the program announcements for the 3 programs. In April, we conduct application beta testing in-house. May, launch the application system. And finally, in June, launch the reviewer module and deliver training materials to the GWG for the review that will arise from the receipt of the application for the 3 programs. And then ongoing from throughout that 6 months will be Gil and team recruiting GWG members to specifically deal with the concept plans at issue and the training of those members in preparation for the GWG itself.
JT?
Yes, sir.
George Blumenthal has a question.
Yes, George.
George, I think you're muted.
Sorry, I'll wait until the end of the presentation.
Okay, thank you. Next slide, please. Okay, so that's the review of the goals and recommendations, the planning going into the implementation. Now we get to a bit more granularity on the development timelines. Next slide, please. So this first slide is about these first 3 concept plans. So as you can see, the top third deals with the meetings of the board, starting with today, the science sub, the board meeting in January, the science sub again, and the board meeting in March. This deals in the second third, as noted on the first tranche of concepts, the DISC 4 and 5, the so-called PDEV, and the CLIN 2s. And then the bottom third reviews what I just went over, which is the development of the 3 PAs, the posting of the PAs in late April, the co-development of applications in the grants management system, applications opening for the 3 in late May, and then the GWG recruitment and training ongoing for those 3 concepts. Next slide, please. Okay, so this is the slide which deals with the balance of the concept plans that we're going to be bringing to the board. So this starts in June of 25, which is at the tail end of the development of the first 3 concept plans. We are looking to bring the second tranche of concepts to the September board meeting, which we will have done all the same stuff we've discussed for the other 3 with respect to these additional concept plans, those being for the technology platform program pilot, the rare disease platform pilot, the EDUC training programs, new and amended, and the EDUC One conference grants, such that the board will be voting on those and hopefully approving the implementation of those at that September board meeting. The program announcements will then be developed subsequent to that approval, having of course been worked on in advance, much as with first program announcements I discussed earlier. And you have the same development of the applications and the same recruitment and all of that. So you'd be looking to have the launch of those applications likely January of 2026. If it happens earlier, that will be the case, but right now that's when we're targeting. I should note that as I look at this calendar, it has one glaring omission, which should be in October, where it should read Dodgers win second consecutive World Series. Next slide, please. I thought we were going to get through that without me back by Maria. All right. Had to work that in. Thank you, by the way, everybody, for your congratulations on that. Yes. So
It's such a big role.
yeah, right. Yeah. So our last substantive slide here is a recap of the timing of the concept plan developments, when it's all coming and all that. So again, you can see in blue the 3 programs coming in March. You can see the items that are labeled number 2 on the far right, which are going to be coming in Q3 and 4. Spilling over to early 26, and then item number 3 would be in Q1 of fiscal 26-27. That being the CLIN 4. So that gives you a sense of timing of everything that goes into the development of the concept plans, program announcements, product launches, etc. And with that, next slide, please. Questions? George.
Yeah, thank you so much, JT. First of all, I want to recognize how much work went into both producing the SAF and in coming through with an implementation plan that implements these new concepts so quickly. So I think you and the staff at CIRM really deserve our thanks for having worked so hard on this while doing all of the other things you're doing at the same time. So I want to acknowledge that. I also want to acknowledge again the importance of the SAF for the future of CIRM. This was needed to address some of the issues that we had with regard to the volume of proposals and with regard to some of the new things that were coming down the pipe. We kind of had to do something. And I think that the SAF that was developed does that extremely well. What I really like is that there are clear deliverables associated with this planning. And I also feel compelled to mention that the timing is good as well with the changes that you alluded to before taking place potentially in Washington, D.C. I think it's really important that we have our own act in order and in place in terms of how we're going to deal with issues going forward so that it's clear we know what we're doing. So really, this is just a comment to say thank you to you and to the other staff and all that you've done over the last 6 to 12 months on this new idea.
Thank you, George. That goes to everybody on the team. It was a total team effort, large T, board and internal team. So thank you, everybody, for your incredibly hard work.
Thank you, George. Next is going to be Carolyn, followed by Anne Marie.
Yeah, I wanted to add that having been part of this process and seen the presentations along the way. It is incredibly well thought out, well laid out, and really sets up CIRM for great success going forward. I also agree with George that the timing is right to get to implementation. And I guess thanks if you had any particular role in the Dodgers win. So as well.
Very happy that you asked that, Carol. Yes, I was the sole supporter of the team in the South San Francisco headquarters, and therefore take full credit for everything.
Appropriate.
And Marie?
Yes, thank you, JT. Thank you to the team. Two questions. One is, can you or someone in the team remind us what CLIN 4 is? I understand that we've funded phase 1 and phase 2 trials. Can you please remind us the strategy about funding phase 3 trials? Do we not fund them expecting that industry will do so, but we continue to follow the outcome, including the maze of the regulatory approval? Because ultimately, this is clearly our goal to all of us, to see these drugs to patients. And so I'd love to have clarification about our philosophy and actual process for phase 3 trials and beyond. And by the way, this is remarkable that the FDA has granted this RMAT, which is the Regenerative Medicine Advanced Therapy designation, to 2 of other programs that were initially funded by CIRM. This is my opportunity to, again, say kudos to the team at large, CIRM, ICOC, all of that, to have selected programs that are so valuable that the FDA is going to help them with special attention. So that was my question number 1, phase 3 trials, CLIN 4. My question number 2 is, I may have missed this point, but I thought we were going to discuss the difficult topic of how much financial support we should provide to ultra-orphan drug diseases. Thank you.
Okay, with respect to the CLIN 4, as you remember, is designed to help projects that are just about to BLA get over the finish line. And that is, so it's not a program to fund phase 3 trials. This is something which of course are extraordinarily expensive. This is specifically tailored to give funding that will help those projects achieve BLA status. And that is something that is we've developed previously, but we're under the SAF. Just as with everything else, we're reconsidering the form that will take, and that is going to be something that will be developed and brought back to the board for its consideration in its new form when it resurfaces. As far as on the issue of how much to give to ultra rare diseases, remember that we're in the process of considering everything here, including what we're going to be doing in rare disease. As we've noted previously, that has amounted to roughly 50% of our portfolio to this point. So it's something that we are very strong supporters of. But as with everything else, the development of the details of that is going to take place in sequence as we put together the concept plans for the various programs. And so we will be coming back to the board with full recommendations on where we go at the appropriate time in the timeline continuum I just described, to get full input and discussion on what we want to prioritize in that regard. We're going to have this pilot program we talked about, platform program, but at the same time, we remain committed to funding rare disease across all 3 of the basic pillars in addition to that. But the details of that is all TBD. So in answer to that, I would say stay tuned.
Great, thank you, appreciate it. I really appreciate it continues to be on the radar screen of the service.
Yeah, okay. Maria? And then, is it Suzanne? You'll follow Maria. Thank you.
GT, I think understanding the CLIN 4 better would be really helpful because I know there have been a couple of programs that came through that seemed like they would have been primed for a CLIN 4, but instead came in with a CLIN 2 mechanism. So understanding the difference between the two will be really important moving forward.
So the CLIN 2 and the CLIN 4, so these the projects that Maria is referring to are a couple of rare disease grants that recently got the CLIN 2. The idea was for those two projects to get the development of them far enough along so that they would be prepared to apply for this final push across the PLA goal line. So they came back in CLIN 2 form and will be down the road, and that funding is going to take them over many months, at which point by the time they would come back for a CLIN 4, we should well have determined the contours of that program as revised and be able to consider them for application. Of course, nothing is guaranteed, but is that adequate, Maria? Would you like
Thank you.
Okay.
That's great. Thank you.
Yeah.
Suzanne?
So I just want to voice my appreciation also for the work that went into this strategic plan. I think it's very impressive and very timely to have a refresh at this stage in CIRM's funding for the objectives and goals. But my question is maybe a little philosophical. I'm interested in, because of the sensitivity of the point in time where we are with CIRM funding through a bond measure, how do you see the strategic plan interfacing with what we heard about our veto's thoughts on sustainability? I realize that's kind of a broad question, but I wonder if you could just make some comments on where you see sustainability in this strategic plan. Thank you.
Well, I don't want to usurp the chair's domain here. I will just say that any sort of notion of sustainability derives from a program that's generating ongoing success. So as to prove to the among other things, the taxpayers of California who voted twice to fund CIRM, that we are making progress. And progress is defined variously in many different ways. There's obviously at such time as we start having programs that get across the BLA finish line and reach the public, that's one measure of success. But you can go all the way back to basic research, which discovers biomarkers or other targets or whatever that set the table for the translational and clinical work to develop therapies years down the road in diseases that heretofore have had no biomarkers or targets to this point. Those are great successes too, and everything in the middle as we proceed along developing the programs that we fund. So I think at the end of the day, we're going to, as Vito is considering the sustainability plan, we're going to take stock of how we have done, which we believe to this point we've done very well across the continuum. And that will inform whatever method of sustainability may be the order of the day as Vito and the board envision it. Would you like to say anything more to that?
Sure, right, but you said it really, really eloquently, JT, thank you. Where we go, if we go anywhere at all successfully on that, is going to depend on amplifying what I consider to be, what we all consider to be our extraordinary record, our record of success. Not enough people in the state of California are aware of what we do and how well we do it, how well we spend their dollars. And that's part of the program, and I'm gonna love to hear from all of you on that, but he's right. What JT is putting into creating and putting into practice is a plan on how to use best the resources that are remaining to us. Pardon me. So if I could segue, Kim, I'm gonna go first with a question or an observation. Thank you. Pardon me. This is more an observation, JT. Our review process is so crucial to the evaluation for eligibility and quality and all the other criteria that we establish for all of our programs. And with all of these new concept plans and amendments coming on this spreadsheet alone, there are 5 of each coming in the next year. I assume, but don't want to presume, that with each of these will be some reflection, some what's the word I'm looking for? Manipulation of our review process that might be tailored for each of them, and that we will be apprised of them as they come forward to the board. Am I good on that?
So thank you for asking that question. That's very timely. We've been engaged with Gil and his team and through our executive team on this very topic about elements of the review process that could be improved to meet the goals of the SAF and have a number that are under consideration right now. We will absolutely apprise the board of changes to them as we go along. But the object absolutely is to have review protocols there for all of these programs that meet the needs of whatever the particular program is. So remember, most of what we're going to put in place is applicable across the board, but there could well be some minor tweaks to the process to address specific needs.
Got it. Good. Thank you. Thank you. Kim, your hand is still up, I think. Yes.
Yes, thank you very much, Vito. So I'm also very impressed by the work and the thought process that's gone into this excellent presentation and the plans that are for implementation moving forward. And I am very mindful of the public scrutiny and the anxiety to see actual treatments for patients come out of the work that CIRM funds. It's still hard to convey those to the public, but it's probably easier than some of the more basic science. But I definitely am hearing some anxiety from the community that that preoccupation with getting things across the finish line to therapies may come at the expense of the basic scientific underpinnings of the field. There's still a lot of work there to be done, and it's really our seed corn that will lead to those therapies in the future. So I think that the strategic allocation framework has appropriately balanced these things, but I think we still need to pay attention to communicating the importance of basic science and how the field continues to move forward, because there is this continual input of new ideas, new biomarkers, as was said, fundamental insights into basic mechanisms of disease. And without that, the engine that CIRM can produce will grind to a halt. So I just wanted to make sure that we keep that top of mind, particularly in the communication part, because that is so much harder than showing somebody who's been cured of a disease.
Thank you, Kim. I would note that the fact that there are relatively few regenerative medicine products in commercialization in general is something that is reflected in where we are in the development of our programs. There's very little out there right now in the market anywhere worldwide. And so the field is sort of early midlife. It marches along, but treatments and cures inexorably will come. So we just need to exercise patience on that going forward. On the subject of basic research, we are 100% committed to continuing that. As you know, of the 3.7 billion roughly that we put out so far since 2004, I should say 2006, when we actually started funding things, over $1 billion of that has gone into basic research. And we are acutely aware of the need to keep the early stages of the pipeline in full development. So will not be one iota deviating from that as a major emphasis. So thank you for your comment.
JT, thank you for that, and thank you for the whole presentation and for the work of your team. I'm going to, if it's okay with, proceed with the agenda to the discussion of our financial audit. It's going to be given by Ms. Kathleen Foster, who is today replacing the originally scheduled Mr. Craig Harner, both of the Sacramento-based accounting firm Macias Genie O'Connell. Kathleen is a certified public accountant who trained at UC Riverside and UC Davis. She's been with MGO since 2015, where her title is Assurance Manager. She's worked with many government clients, including multiple cities throughout the state, counties, and other state agencies. And an update on MGO, the auditing firm we're using is in year one of a renewed 3-year contract with us that was awarded after open competitive bidding. MGO has been the independent auditor for CIRM since fiscal year 2005-06. Ms. Foster, the floor is yours.
Thank you to Chair Massian. Good morning to members of the board. Thank you for your time this morning. I believe I am able to share my screen with the financial statements, but a copy I was told was provided to each of the board members in the packet. You see the share feature. I apologize. I do not use Zoom regularly, so I do not see a share button. So I will just, hopefully everyone has the financial statements in front of you.
Can you hold just one moment and we'll try to bring up the presentation and show it in your place. Just hold one moment.
Oh, okay.
I do have the report, Kathleen. Would you like me to share the report?
Yes, that would be great. So if you scroll down a page or two, obviously the table of contents lists the report, and then this is our audit report, and we completed our audit over CIRM's fiscal year 22-23. So that's a June 30, 2023 year end in March of 2024. And the date may seem later to some members of the board. It was mostly due to just some, new questions, new information, discussions with CIRM's finance team that resulted in having to seek some guidance from state controller and or Department of Finance to some of those questions. At the conclusion of our audit, which was conducted, I won't read the report to everyone, but which was conducted in accordance with audit standards generally accepted in the United States and government auditing standards. The result of that was what's referred to as an unmodified opinion, or sometimes, a clean opinion, which is the highest level of assurance for the audit. There was a number of new accounting standards issued by the Governmental Accounting Standards Board. And the most significant one, the subscription-based information technology arrangements, did not have an impact on CIRM's financial statements, which further information in note 2K, as referred to in the report, indicates. The remainder section of the report just lists out responsibilities of management, primarily CIRM's finance team, and our audit responsibilities, which mostly just delineates the, CIRM's management is responsible for the preparation of fair presentation of the financial statements, and our role or objective is to obtain reasonable assurance that those financial statements are not materially misstated. If you want to scroll down to the second page, it just lists further details. And then continuing down into sort of the last section of the page, just lays out some areas of the report. The required supplementary information is primarily management's discussion and analysis, which is unaudited, and it's prepared by management to give a high-level overview of the operational causes that you would see resulting in year-over-year changes in the financial statements. The supplementary information paragraph just describes that the audit procedures we perform over the Dolby grant schedule of revenues, expenditures, and changes in available resources is limited to reconciling and ensuring that it agrees to the overall books and records used to prepare the financial statements. The last section of this report just points to the other report that we issue in accordance with the government auditing standards. And that report is located at the very end of the overall financial statement. You can refer back to the table of contents for the page numbering, but that purpose of that report is simply to describe the scope of our testing and of internal controls over financial reporting and compliance. It's not intended to provide an opinion or any form of assurance on the operating effectiveness of CIRM's internal controls. And, other than that, I would just note, we do issue the third item is a communication to the ICOC, just describing significant financial reporting matters, accounting standards, any significant estimates, any disagreements or difficulties with management, any consultations management may have made with other independent accountants, or just anything else we feel warrants the attention of the ICOC. And there was no real significant matters, no disagreements, no difficulties noted in that communication, no outside consultations. And the most significant accounting change that you will see in that report is that in fiscal year 21-22, there was a new lease accounting standard issued by the Government Accounting Standards Board that went into effect, which changed how CIRM presents its office lease on the financial statements from previous years. And with that, if anyone has any questions.
Thank you for the presentation on the financial audit, Ms. Foster. If any members of the board like to address any questions to her specifically? Okay. Well, thank you very much, and thank you for your many years of continued service to CIRM. Thank you.
Thank you, everyone. Appreciate your time this morning.
Our next item, earlier this month, we convened the Communications Subcommittee to get an update on communications ongoing efforts, including a social media strategy and the rollout of the annual report. We also said goodbye to Corinne Temple-Perry, our Senior Director of Communications. Her last day was December 6th. We thank her so much for her hard work and dedication to CIRM's mission. I'd like to ask Esteban, the interim lead, to walk us through the presentation.
Thank you so much, Maria. Good afternoon. Good morning, members of the board, CIRM team, and members of the public. I'm Esteban Cortez, as Maria mentioned, Director of Marketing Communications at CIRM. I'm part of a team that leads and supports the agency with various marketing communications initiatives and channel management. So this includes external and internal communications, social media, email marketing, print publications like our annual report, managing our website and blog, media and press inquiries, as well as supporting with our community outreach efforts. Thank you so much for the opportunity to share a communications update today. As Maria mentioned, at our recent communications subcommittee meeting, we highlighted our updated social media strategy, which included a content audit, goals recap, CIRM social media case studies, as well as updated goals, tactics, and future considerations. So I'm happy to share the progress that we've made with our social media efforts, as well as some of the ways that you can get involved. So in 2022, we introduced a comprehensive social media plan and strategy to help us stay consistent and organized in our social media initiatives. One major component of this was setting up a metrics system to track social media metrics, including impressions, engagement, likes, and shares. And these metrics have been really important to monitor so that we can measure how well our strategy is performing and identify areas for improvement. In particular, I'd like to highlight our audience growth from July 2022 to October of this year. This is a really important metric to track because it measures our channel's overall health and awareness. And overall, we saw a 22% follower increase in this time period, jumping from 39,464 total followers to just over 48,000. As you can see here, most of the channels experienced growth, but Instagram and LinkedIn, some of our channels, outpaced the others. LinkedIn in particular saw our audience grow by more than 200% and remained one of our top social media channels. We attribute this to boosting our visual content like photos and videos, as well as following best practices like engaging with partners and institutions. And it's important to recognize that each one of these social media platforms we're on is unique and audiences engage differently across each one. For example, our Facebook has over 11,000 followers, a majority of which are age 35 and up, and particularly interested in content that includes community and people-centered articles, as well as lay-level articles that highlight progress in regenerative medicine and disease areas, such as those featured on our blog, The Stem Seller. On Instagram, we have around 3,000 followers, mostly between the ages of 18 and 34. And this audience engages with visual, eye-catching content. This includes posts in carousel format, also known as swipe-through posts, and short video formats, also known as Instagram Reels. And other popular content showcases patient stories, trainee stories, and photos, as well as concise CIRM-funded research highlights. We also share Instagram stories, which are quick visual or text-focused snippets of content that disappear after a 24-hour period. And these have seen a lot of engagement as well. And our LinkedIn audience consists of many researchers, healthcare industry leaders, principal investigators, scientists, and academic partners. And this channel presents opportunities for thought leadership so that our content aims to position CIRM as a leader in regenerative medicine. That's really one of the aims through that channel. And this is where updates on partnerships, research milestones, and CIRM funding perform really well. And on X, formerly known as Twitter, we have about 15,000 followers, primarily consisting of regenerative medicine professionals, scientists, and journalists. And our insights suggest that our audience do still utilize X to receive news updates as well as engage in scientific discussions. Twitter has been a good platform for thought leadership messaging in healthcare and biotech, especially when attached to infographics, photos, or short videos. We also found that using event hashtags in real time, also known as live tweeting, during an event increases our reach and engagement. On YouTube, this is a channel that we recently started to monitor a bit more closely as a social media channel. We have over 9,000 subscribers, diverse in age range. Videos with the most views on here and with the most engagement consist of interviews, webinars, educational content. And we've also started to utilize YouTube Shorts feature more. This is a YouTube version of Instagram Reels, short snippets of video. We've noticed great results in reach, video views when sharing this type of content as well. And then finally, Threads is a newer platform that was released in May 2023. We created our Threads account in December of 2023. And because this is still a newer platform, Threads has been slowly rolling out features that can be utilized, such as its trending, tagging feature and account analytics, which really presents an opportunity to get more involved in scientific discussions and talking about regenerative medicine. We currently have over 500 followers there, and we noticed that our audience is engaged with conversational, community-oriented content, like our event recaps, and they also engage with our short videos. So all of these data and insights have helped us understand how our audiences vary on each platform and what type of content resonates best. So this was all crucial when developing our new social media strategy. And everybody does have access to that strategy. It was posted with the board agenda. So you do have that available for review. But just to give a very quick overview, our new strategy is divided into 3 parts, which focus on awareness, engagement, and content goals and tactics. Our awareness goals and tactics are important because they not only strengthen our brand identity on social channels, they also help educate existing and new followers about CIRM's mission, build trust with the public, and establish our credibility with professionals in regenerative medicine. Our engagement goals are important because they ensure that we're connecting with our followers and inspiring them to share with their followers. And this also helps expand reach and promote visibility of our content that we share. And of course, our content goals ensure that we are sharing a balanced mix of content, including people stories, scientific updates, and relevant information. And while I won't be highlighting every tactic tied to each of those 3 pillars, here are some best practices that have contributed to our success and growth in social media. One key awareness strategy that we'll continue to leverage is continuing to build relationships with CIRM stakeholders, CIRM-funded institutions, and community partners to collaborate on social media. One example that I'd like to highlight was in August, our then scientific programs and education team updated us that a CIRM Compass trainee from Solano Community College, Jose Solorio, he registered with the National Marrow Donor Program and matched with a donor matched with an 11-year-old patient from New York. We were able to connect with Jose, the communications team from Solano Community College, the NMDP, as well as Stanford's Laboratory for Cell and Gene Medicine to amplify this story. We saw really great results with an organic reach of over 7,000 users and over 750 engagements across our social channels. This is compared to an average reach of about 100 to 600 unique users that we typically see. So in sharing these collaborative posts, tagging each other, we were able to reach Solano Community College and the NMDP social media followers in addition to our own. We also developed messaging, a press release with Solano Community College, media pitches, and this resulted in the story getting picked up by Cron 4 News, Yahoo News, as well as AOL News. Another awareness strategy that we're focused on is continuing to leverage events to reach more audiences. So for example, every October, there's Stem Cell Awareness Day that we celebrate. And this year we created a week-long mini campaign during which we shared content that consisted of quick 30-second videos, video snippets of CIRM staff explaining the importance of stem cells, why stem cell research is critical, and why the future of regenerative medicine, what the future of regenerative medicine looks like. And this content received really good engagement and reached nearly 11,000 unique users across our social channels, which is really significant. An engagement strategy that we'd also like to continue is utilizing digital and social channels to host more online forums and webinars and also reach more communities. As an example, in August, CIRM hosted the webinar Exploring Advances in Eye Diseases and Regenerative Medicine. Our comms team worked with the community outreach manager, Aditi Desai, and outreach senior advisor, Jacqueline Hankin, to promote the webinar. We, of course, created our own social media posts and email campaigns to promote to our own followers. But we also aim to reach even more communities where they are. So to do this, we shared the webinar information with vision loss and retinitis pigmentosa Facebook groups, some of which had tens of thousands of followers. So that really supported with not just spreading awareness of CIRM, but inviting them to attend this webinar. So we did see nearly 150 registrants for that event, and we considered that a success. The Facebook groups and other online forums really present us with the opportunity to engage with more community groups, including patient advocates, as well as people living with diseases or conditions for which CIRM funds research. Then another key strategy to boost our social media engagement is developing and distributing social media toolkits and content sharing guidelines with CIRM stakeholders, partners, grantees, and trainees. And this is something that we're actively working on, and it's an ongoing effort. But as an example, in June, we developed social media toolkits and social media challenges to encourage CIRM trainees to engage with us and on social media. So with the help of the scientific programs and education team at the time, we connected and shared these toolkits with educational program directors and program participants. And this was successful because it garnered a lot of interest and excitement for the Spark and CIRM trainee networking conferences that we hosted. And we also saw many program participants create and share content for us, tagging us by using event hashtags like CIRM Spark Lab and CIRM Trainee Conference. Overall, we saw that we were tagged and mentioned over 100 times between the week of August 9th through the 15th when the Spark and the trainee conferences took place. And we saw a ton of engagements with these hashtags. So that's one of the reasons we want to continue this engagement strategy. And then finally, on the content side, we will work to increase and streamline our guest writer and subject matter expert content across our social channels. Over the past couple of years, we've developed surveys and questionnaires to encourage our trainees, researchers, and patients to share their stories and expertise. So for example, all of these features that are pictured here on the slide have stemmed from surveys and questionnaires. We find that people are very forthcoming and happy to share their experiences and expertise when presented with the opportunity. Evie Jr., for example, pictured on the bottom right, he's a patient in a CIRM-funded sickle cell clinical trial. He answered a survey sharing his experience as a participant, as well as his thoughts on the importance of funding sickle cell research. And while, of course, we aim to do face-to-face and in-person interviews when possible, taking this approach has really streamlined the content creation process and will remain a key strategy to help us meet our goals. So because our social media strategy, of course, is always evolving, we've identified further opportunities and consideration. These include identifying social media monitoring tools, boosting our content for platforms like Threads, which is rapidly evolving, as well as boosting production and sharing for short form video content across our channels. And as far as some considerations, we're of course monitoring platforms like TikTok, Blue Sky Social, which has recently emerged as a new platform, as well as channels like Reddit and Discord to see how CIRM can really utilize these to reach more audiences. And this brings me to my last slide and my call to action. We've seen a lot of success in social media thanks to engagement from CIRM staff and members of the board. So if you're not already, I really encourage you all to follow us on any of these aforementioned social media accounts. If you follow us already and see our content in your feeds, please be sure to engage by liking the posts, and even better, please comment, share, and tag in any relevant CIRM-related posts. This really helps us by boosting the content organically and also reaching your friends and followers who may not be aware of what we do, and that's really important. We also encourage you, of course, to connect us to organizations you're a part of for social media and outreach collaboration. And if you're willing, please consider contributing content, whether it's a photo of a CIRM event, tagging us, and also consider writing an article for our blog, The Stem Seller. That's always very, very helpful. So we're already seeing a lot of board member engagement on social media, but of course, we always encourage and appreciate more. And before I conclude, I'd really like to recognize my team for all of their contributions. In particular, I'd like to recognize Christina Smith, who took these insights from the past couple of years to update and develop the strategy, as well as Katie Sharifi, who was instrumental in setting up our metric tracking system and who supported with our 2022 social media audit and plan. And of course, would like to recognize Corinne Temple Perry's efforts for really leading our team during this time as well. And this presentation is just a snapshot of our upcoming tactics. So I encourage you to take a look at the strategy and reach out if you have any questions or suggestions. Thank you all so much for your time today.
Esteban, thank you very, very much. That was such an exciting presentation. Board members might have some comments or questions for Esteban. They're too busy entering. Kim.
Yeah, I'd just like to ask what the strategy and timeline is for replacing Corinne's position, given the paramount importance of communications, especially in the context of sustainability.
I'll take that. So, thanks for the question, Kim. This is a top priority. We are in the process of, couple things. One is, doing reconnaissance with KOLs in the communication field to get input, which includes a number of board members, to get input on what qualifications and criteria would go into making the ideal person to lead the communications team. Separate and apart from that, we're well into developing, based on that and general thoughts on the subject, developing a job description, which we're in the process of discussing in-house with a goal towards posting for the position sometime in January. In the meantime, Esteban and Christina and Katie will carry on leading the communications effort. I stepped in. I'm now meeting with them on a weekly basis as a team, plus meeting with Esteban as the head of the program in the interim period to make sure that we're proceeding apace on all matters we should be focusing on in the communications area.
Thank you.
JT?
Well, thank you.
Oh, sorry. Did you ask me? I'm not sure.
Yes.
Isabel, yours.
Thank you. Thank you. As you recall, in our last subcommittee meeting also, Esteban and JT, that we talked about preparing for what might come, how it might come back to CIRM in terms of the new administration. I was back in Washington just last week, where they seem sometimes to be walking around the whole issue of DEI. I'm very concerned. You brought it up to some extent, JT. I think that the board should understand that we have talked about it, but I also think that because we need to prepare strategy, I think the rest of the board should perhaps contribute some ideas to how that approach might be, or what we might be saying, when we might be saying it, so that we can be in front of the issue instead of responding or reacting to the issues that might come up. I mean, they may not. If we're lucky, we get unnoticed, but we never can tell. And therefore, I think we need at every level, including our DEI policies, which I think are leaders across the country, we need to be ready to defend all of that. And so I just want the board in toto to understand that we've already talked about it, but I think we need your inputs as well.
And I would just add, Isabel, since the discussion on this topic in the communications subcommittee, Esteban and I have been discussing how to develop messages that anticipate what could be coming down the pike here, so that we are prepared to deal with them. I agree with your notion that we should be front running on some of these issues. DEI being obviously a critical component of everything we do, as an example. So we're well into considering the game plan there, and understand that this could be a big challenge. Hopefully not, but certainly could be for sure.
Carolyn, you're next.
I'm glad Isabel brought this topic up. I'm in DC now, will be for a week, trying to figure out what is likely and what isn't likely in the new administration as we talk about research priorities. While we want to be true to our values and our mission, California may very likely be a target, so we have to be careful about balance our commitment with how we describe it. So glad to engage in further conversation on this issue. It's really important.
Thank you. Thank you, Carolyn. I see Deborah's hand up.
Yes, I too agree with what's been stated, that we need to have these discussions. At the same time, I believe that we need to, as Carolyn stated, remain true to our values and stay the course. Sometimes when we get into these discussions, we may preemptively begin to dismantle on our own, as opposed to resist what's coming. And as you have heard from our governor and others in California, that there will be resistance, and no one's asking us to make these changes. It doesn't mean that we can't have the discussions, but I get a little concerned that we begin to change and modify things in anticipation. And as a result, we dismantle and no one else forces it on us. So that's just a word of caution there.
Thank you, Deborah, for those considered comments. I don't, Elena, you're not raising your hand. No, I don't see any other hand. I don't see any other hands.
Vito?
Yeah, Isabel, if I could just respond, if I could just respond quickly to Deborah.
I too want to respond.
All right.
Deborah, I totally hear you. Nobody's doing anything but staying the course, and they have no intention of backing down from whatever. So thank you for your comments.
Thank you, JT, for saying that, and thank you, Deborah. That, of course, is the reason why we had the discussion in the communication subcommittee, not because we were going to change how we do what we do, but simply to be prepared to defend it should we need that. And in fact, maybe even be bold enough to take on some of the issues that come down the pike and that attack science, maybe in general, or maybe more specifically to CIRM, but be able to have various of you come to the table, write an editorial or write a response, so that we're not just protecting CIRM, but we're protecting science. And so this is sort of a proactive way to think about it, to be out in front of it, as JT mentioned, and as we hope to do it. But backing down is not in my field of vision, and it was not in the subcommittee's field of vision. So just wanted to reassure you that we're going to full steam ahead.
I thought you were going to say it's not in your DNA, Isabel.
That too. Thank you.
Thank you. No other comments? I guess we've come to that part of the meeting where I will ask any member of the public who would like to raise any issue that was not on today's agenda. And seeing none, I'm going to take this opportunity as we close out the year to thank all the board members for their attendance at these meetings, for all of their hard work in all of our subcommittees and task forces, for all your advice and support throughout the year. I want to wish each and every one of you a healthy and a happy holiday season and a bright and promising start to the new calendar year. I will see you all at the next in-person meeting of this board on January 30th, 2025. Thank you again. This meeting is adjourned.